My name is Jackie Gutman. I'm a reproductive endocrinologist, otherwise perhaps more commonly known as a fertility specialist. I am a partner at RMA of Philadelphia. I went to Union College, which is a small liberal arts school in upstate New York. I was a biology and German major. From there I went to the Yale Medical School. I spent a number of years in New Haven after that, where I completed my residency in obstetrics and gynecology and then my fellowship training in reproductive endocrinology and infertility. When you're a resident, you do different rotations. You have exposure to general gynecology, you have exposure to gynecologic oncology, and exposure to obstetrics, obviously, as well as reproductive endocrinology. And from the moment that I was exposed to reproductive endocrinology, I loved it. I loved the individuals and women who I was working with. I loved the clinical challenge of it. I loved the science behind it. And I knew immediately that that's what I wanted to do with my life. And I've been lucky enough to be able to do that. I'm an associate clinical professor at Thomas Jefferson University in the Department of Obstetrics and Gynecology. I'm active in a number of different professional organizations and have held leadership roles in those organizations. And I'm also very active in a number of organizations that are devoted to and committed to helping individuals and couples who are experiencing infertility. I enjoy being a part of those organizations. I enjoy my role in those organizations. But certainly what I enjoy most is coming to work and being an infertility specialist. I love everything about my job, and I know that sounds incredibly corny, but it really, really is true. I love working with individuals and couples to be able to help them build a family. I love working with them to be able to explore the appropriate options for them, because everybody's different. This is not one size fits all. Whether it's less complicated treatment like using oral medication or perhaps doing insemination, or if individuals or couples require much more complex treatment like in vitro fertilization, all of it is exciting, all of it is interesting, and it's a challenge to be able to work with individuals and couples to find the treatment option that's best for them, that obviously takes into consideration evidence-based medicine. Needless to say, one of the best parts of my job is being able to tell individuals, to tell couples that they've achieved success, that they are pregnant, that their dream of building a family will be realized. The other part of my job that I find very, very important, perhaps a little bit less fun, is working with couples who don't achieve success, working with individuals who don't achieve success. Unfortunately, sometimes it happens. Most people are successful, but sometimes they're not successful. And I have a very important role there to play in helping them through that transition. RMA is a world-class fertility practice where we provide hopeful parents with individualized care plans. We provide them with tremendous expertise, a world-class laboratory if that's going to be required. Patients who are here see their doctors on a regular basis. We're always accessible to the patients either by telephone or email. We have a team approach, and we hope that when patients come and see us, they feel comforted and welcomed by the environment, and particularly knowing that they're getting the best care available.